I'm ward manager of Seddon Rehabilitation Unit, which is at St Helens Hospital. It's a spoke unit of the Cheshire and Merseyside Rehabilitation Network, the hub being based at the Walton Centre in Liverpool. We provide complex rehabilitation for the patients that come to us here on the unit. We have 20 beds. I manage approximately 35 members of nursing staff here, and I also liaise with the other disciplines who provide the care for the patients while they're here. Those people being physiotherapists, occupational therapists, psychologists, and so on. I chose to work in specialist rehabilitation because I wanted to not only address a patient's nursing needs, but look at them holistically as much as possible and try and cover every aspect of the care that the patient needs. And I feel here in this setting, we've managed to do that better than anywhere else I've ever worked before. That's testament to the multidisciplinary team that is here and the disciplines that are part of that, because we can address not only patients' functional needs but also the psychological needs, the spiritual needs, any needs that they may have that have been affected by what's happened to them, to bring them here to Seddon Unit. We can address as a team, and that's part of specialist rehab that I love, really. I think we can establish an excellent rapport with our patients here on Seddon Unit. We have longer time with our patients, so we're able to appreciate what their needs are more and meet them in a more timely fashion. One of our patients that we've looked after recently sent us a thank you letter saying, I came to you physically and mentally broken and you put me back together. And I thought that was a lovely phrase. I felt really humbled by that, to think that somebody who we'd looked after felt that strongly about the care that we'd given and how their needs have been met while they were here. Our patients have been through sometimes terrible incidents before they've come to us. Their lives have been totally shattered in their view sometimes when they come to us, and it's our role to try and piece back together and give them back the best life that we can before they leave our setting. And I think that comes across, not just from me, but from all of our staff, that that's what we're trying to achieve for them. Here on the unit, we try to make sure that our families and our loved ones of our patients are involved at every step of the rehab process for our patients. So they're encouraged to come along to the initial meetings here on the unit, the goal planning, and obviously the discharge meetings as well, so that we can ensure that the care that we've provided here continues on into the community, because the family and the loved ones are going to be providing that care or supporting that patient once they get home. So that's very important that they're involved in that aspect of the ward and the care that we provide here. Our families and loved ones get very involved as well with how we deliver the care to the patients here, and we really appreciate any comments or suggestions that they have to make. One of those suggestions is to provide a forum for them that's a more structured setting, in a more meaningful way. We can sit down with them and listen to anything that they think that we could add to enhance the experience for their loved ones here on Seddon. So we're hoping to get that up and running very shortly. The role of the rehab nurse is quite unique, I think. It's something that hasn't been very readily defined for the nurses who came here to look after our patients. So they've they've masterminded their own role, I think, in looking after the patients that come to us here on Seddon. Because not only are we addressing the nurse and care needs for the patients here, we're also providing a listening ear. We're providing a link between them and the rest of the team, because we're the only element of the MDT who are here 24 hours a day, 7 days a week. So we might see things, in the middle of the night or on a Saturday and Sunday when the patients have got more downtime, that the other members of the multidisciplinary team might not pick up on. So I think that's a really important role that our nurses sometimes don't realise they have, because they just do it naturally on a day-to-day basis. There's also some key nursing skills that they employ here that they probably wouldn't use elsewhere because of the specialised needs of the patients who come to us. I think from a rehab nurse perspective, as I say, we can sort of cross over into the other disciplines, and we're helping out obviously from a therapeutic point of view, because we're moving and handling the patients day to day. We cross over into the psychology side of things, because we can be that listening ear in the middle of the night sometimes when our patient is feeling down or needing to vent about the situation that they're in. I mean, the injuries or the conditions that our patients have an effect, very much so on the psychological aspect of them as individuals, and it's really important from our perspective that we address that as well as the nurturing requirements. I love what I do here on Seddon Unit because of the care that we can provide for our patients and the quality of that care. I've come from an acute setting where sometimes the busyness of the wards can prevent you from doing what you came into the job to do, and that's to sit with your patients, provide the care one-to-one. And here on Seddon, we have that amazing availability to do that, and our patients are really appreciative of that, because often they've said to me that it's that aspect of being available to them, being able to stop, sit down and listen to what they've got to say, which sometimes is more to them than having the tablets on time or having the dressing changed on a daily basis. So obviously we make sure that that's done and their care plans are met, but I think that aspect of having that time, getting involved with our patients, to me is a brilliant part of my job, and also the team that we've set up here on Seddon Unit are a fantastic team, and without them we couldn't provide the excellent care that we do provide here.